I'm going to take you on a tour of DiaDirect, the app that's designed to enhance the care of patients with diabetes. DiaDirect is like a hotline right to your nurse, who can see information real-time about your vital signs. They can intervene early if needed. This information can be sent also to your cardiologist, nephrologist, or primary doctor if needed. This is part of a movement in Medicare called Remote Patient Monitoring and Chronic Care Management, which optimizes the outpatient continuity of care to minimize the need for hospital services. So let's take a look. Open up your phone and find the DiaDirect icon. Click on the icon to open the app. This will take you to the home page, and the home page will show you all of your different vitals: blood pressure, blood sugar, and weight. Each of these types of vitals has a different care plan about how often you should measure. If we want to look at anything specifically, you click on that item and it will show you the trend, both in a list and on a graph, of what's been happening with your vitals. To take a new measurement, you click the plus sign and you select manual data that you'll input yourself or syncing data with your iHealth device. We chose a manual selection, so I measured this with my separate blood pressure cuff, and I'm entering this information, and we click Add Data. You know it transferred the data when you can see the new measurements pop up on your graph and your list. We'll go back to the home page, and let's check blood sugar. The same method applies here. Click the plus sign and select Manual or Sync Data. In this case, I took blood sugar from an other glucometer and I entered it manually. Again, you can see that it popped up on the left side of the graph and on the list of entries. Let's try syncing data. So now it's going to ask me which device I want to sync, so I'll select my glucometer that's made by iHealth, and it connects by Bluetooth. It shows me the last measurement that I took, so I'll click Save, and I can see it pop up on my list. Now I want to chat with a nurse because I have a question. And when I open the chat, it will show me any messages that have gone back and forth between myself and the care team. So I'll type in my question, and the nurse will receive that in real time. There is a nurse attending to the patient portal every day who will get this message and respond back. Now let's look at the care plan. So every day, a care plan will come up and show you what it is that we're looking to measure. In this case, we've asked to measure blood sugar every day at alternating times, as well as blood pressure. Once a week, we ordered a weight check, with the caveat that you can check anytime if you're noticing a change. In the notifications, which you will receive every day to remind you to check your blood sugar, blood pressure, or weight, you can select that notification directly and enter your data. We can see that that measurement was done and the notification drops off. Now, if I want to see all my devices that I have connected, I can click in the upper left and it'll bring me to the iHealth page and show me all of my items. You can take measurements directly through here as well. Now I'm interested in sending my blood pressure information to my cardiologist. I'm going to go into my measurements. I can see all of them there. And in the upper right corner, you see the arrow. So you're going to click on that arrow, and it's going to ask you how you want to send this information. The top option is an Excel spreadsheet, and the bottom selection is a PDF. I'll click PDF at this point, and I'll select Mail, and I'm going to type the email, and then I can click, and away it goes. If you're having problems navigating, you can always click in the upper right corner the question mark, which will take you to the help page on the main website.